brief comments on this bill. Mr. Speaker, this is a bill brought by a very able legal mind, senior counsel, and I want to have a serious conversation with the senior counsel in terms of this bill. I've looked at the realistical aspect of this bill, and I know that the senior counsel has taken the Constitution and has based his reasoning in this narrow bill on Article 28 of the Constitution, which I'll read. Every person has inherent dignity, has inherent dignity and the right to have that dignity respected and protected. That's number one. And that is the reason why he came up with a bill that prohibits the hospitals from detaining corpses. He has also looked at Article 43 of the Constitution, which is every person has a right to the highest attainable standard of health, which includes the right to health care services, including reproductive health care. But, Mr. Speaker, in this day and age, there are a couple of things that determines whether these two rights, which are enshrined in the Constitution, can effectively be granted to the citizens. And I see a big challenge on this bill. I have listened carefully to the majority leader when he was making his submissions, and to some extent, I agree with him. Because unless, Mr. Speaker, we do the following: we establish an emergency medical treatment fund under SHA to reimburse all facilities that will be able to adhere to the implementation of this bill will not succeed. Mr. Speaker, there is a penalty of 3 million shillings to any facility that will violate this bill. That in itself does two things, Mr. Speaker. This bill does not, in its intent, it excludes all private institutions, faith-based initiative hospitals. But in its practicality aspect of it, if a patient has died in a faith-based initiative hospital or in a private institution, this bill will apply. So I think it is important that the distinguished senator broadens the definition of this bill. Number two, Mr. Speaker, from where I sit, and I've tried to think thoroughly on the practicality of this bill, because this bill does two things which are very clear, Mr. Speaker. Number one, it tries to balance humanity and the reality, financial obligations and responsibility of institutions. And number two, it tries to make sure that everyone respects this Constitution. But there are bodies out there, Mr. Speaker, like I know there is the Rural Urban Private Hospitals Association of Kenya, which has got big concerns with this bill. They are concerned that this bill will cripple healthcare in the country. Because if it's a small institution, facility, that has got a lot of consumables, they have to pay for medicine. Then you have a patient who goes there. From a humanity point of view, and from a political point of view, a legislation point of view, I'd be the first one to say that hospital must provide that patient with that treatment that patient deserves, whether that patient has got money or not. But what happens if that hospital does not have money because it has done so for 10 or 20 other patients who have consumed all their stock? That hospital will now end up going bankrupt. It will reduce their services, and mostly it will be very difficult even for them to open because they'll be afraid that they'll be charged 3 million shillings as a penalty if they fail to provide that service. So, Mr. Speaker, the distinguished senator has got to balance and to make sure that he takes care of the interest of this association, because this is not just a pedestrian association. It's an association that has got over 400 or 500 hospitals. Their voice is concerned. We always talk about public participation. We always talk about coming up with laws that can be able to be implemented. One of my biggest pet peeves, Mr. Speaker, is when we, as legislators, narrow the scope of the amendments. Maybe the best thing would have been to overhaul the entire Health Act. And we have attempted. We have mutilated the Health Act. In the last parliament, Mr. Speaker, we mutilated it. Come to this parliament again, we mutilated it. We created SHA. We had NHIF. There are debts associated with SHA and NHIF. Most of these private institutions and faith-based hospitals are still owed billions by SHA. So unless you tell me that you are going to pay all these things, all the debt which is owed to these hospitals by SHA, NHIF, there's no way that you can convince me that even if you don't, in terms of the intent, capture these hospitals, the broader wording of the bill covers them, because you have got to look at the Constitution. Mr. Speaker, in literature, we were taught not to just read what is written there. You've got to understand the meaning of the text. In college, we studied critical writing. And one of the things you do is that you try to analyze the content, the context, so that you are able to deduce the meaning of the law. So in this case, Mr. Speaker, I'm concerned. And I would like to persuade my colleague that instead of waiting for regulations from the Cabinet Secretary, why not, at the Committee of the Whole, bring in further amendments to the amendment? And number one, do the following. One, require county government to set up 10% of their health budget to cover this emergency treatment. So that's number one. Number two, Mr. Speaker, have a broader conversation with the national government and the Ministry of Health to set up an emergency medical fund that will reimburse all hospitals, all facilities, including faith-based initiatives and rural health facilities, up to at least at minimum 50% of their expenditures. Number three, which is the most important one, Mr. Speaker, we are all talking about, and I'm sure this is why the distinguished senator brought up this piece of amendments. Everyone is talking about universal health care. Everyone wants universal health care in Kenya. And we're all clapping our hands and saying, yes, we are going to achieve universal health care. Mr. Speaker, the other day when we were seated somewhere, one governor said, oh, hii SHA haifanyi kazi. Hii SHA is not working. A governor of a county. But here we are pushing and saying SHA is working. Because all of us want to achieve universal health care. Then why don't we do this? And maybe this is one of the things that the distinguished senator can add in his bill to make it practical. One, pair nationwide registration of SHA with this, sort of like with this law. In the sense that the only time that you will be reimbursed or you will be given, or any facility will give you treatment, they will not detain the body of the deceased, is when you have taken the responsibility of registering yourself as a SHA member. You have to pair that, so that you make it also conditional. The challenge we have, Mr. Speaker, is that people tend to forget that my right begins where yours ends. So in this case, these institutions have rights. It's their businesses. So unless you show me how you're going to make sure that that business does not collapse, it will be very difficult for anybody to challenge this, Mr. Speaker, to support this, Mr. Speaker. So, Mr. Speaker, it is important that we pair all SHA registrations, or rather enrollment, with the intent of this bill. So I'll leave that to the distinguished senator. for him to find out how is he going to make sure that it's done like that. And it can be a prerequisite, Mr. Speaker, that when you come into a health facility, the first thing they ask you is that please provide us with your SHA registration. If you do not have, even if it's a faith-based initiative, you are registered there. You are registered there so that we can then achieve this universal health care. Otherwise, Mr. Speaker, if we do not do that, a lot of hospitals will close. They'll close shops. They will go to other places. Because remember, whatever legislation you draft, there are people out there who will say, how best can I survive? And either bypass this bill and carry out other services. People might decide to say, tomorrow, I'm just going to open a lab. And in that lab, I will buy a dental X-ray machine for 3.5 million shillings. And I'll wait for the patient to go to the hospital. Come to me, they will pay me money, 20,000 shillings, I carry out the X-ray. I'll have a CT scan. Mr. Speaker, there are so many ways in which people can be able to go around this piece of legislation, to remain in business. So to avoid that, I believe that this RUFA, their concerns must well be taken into consideration during this bill, so that when this bill leaves this House and goes to the National Assembly, our brothers in the National Assembly might welcome the idea of setting up this emergency fund, which can also be funded by the consolidated fund. It can also be funded by the County Revenue Fund. Mr. Speaker, if you look at Section 109 of the PFM Act, it talks about the County Revenue Fund. So with my earlier submission that let's take about 10% of the health budget and put it into this fund. You know, it can help to ensure that we achieve this universal health care. Mr. Speaker, if you look at the PFM Act again, and I always like to take different pieces of legislations to try and see how they can come together and how they help one another. Just like the other day when we were arguing here on the Public Audit Act. If you just juxtapose it with the PFM Act, you will see where it collides and where it needs to be aligned. So the same case applies here. It's all about money. You know, it's all about how do we fund this. I feel like the distinguished senator did not focus a lot on how we fund this bill. The biggest focus, and I want to repeat, he looked at the Article 28 and Article 43 of the Constitution. Finally, Mr. Speaker, there's also another very beautiful way where you can be able to make sure that this bill, once it's signed, and I really hope that the distinguished senator will make those adjustments and then go to the National Assembly and we push it and it becomes a piece of law, is to ask, or rather to introduce a conversation of tax incentives. You know, a hospital is a business. If today you ask Senator Kajuang or Senator Otsotsi, when you ask them a question of ONSO's revenue, they'll tell you that in every county, the biggest chunk of ONSO's revenue is from a hospital, of that hospital. The reason why we got into that quagmire or that problem is because of the bylaws, where anybody can become a member of the SACCO. And then they come in and they appoint a chairman who does not really understand things to do with the law. So I appreciate what the president did in making sure that he safeguard that institution, because it's a pride of our country. So give those institutions tax incentives, you know? So Senator Senior Counsel Omugeni, through the Speaker, offer tax incentives, or even better, in this House, the two things that determines this House, the importance of this House, is normally the division of revenue, number one. Number two is the issue of the county revenue CARA bill. And then number 3 is the conditional grants. Why not set up conditional grants specifically to be able to take care of this problem that we have in our country? If we are able to set up conditional grants, and I've sat with this gentleman here for the last 8 years, and there were conditional grants which were given to that medical scheme for equipment. Why not set up conditional grants to be able to guarantee this universal health care and to guarantee that if a relative dies, the hospital will not be able to detain the body before they are paid their money, because the hospital know there is a conditional grant that they can be able to get. Or there's a tax incentive. Or there's an emergency fund. Those are things that are practical, Mr. Speaker, that will be able to help us implement this piece of legislation. Finally, Mr. Speaker, I think it is also important for the distinguished senator to relook at this very punitive penalty of 3 million shillings. I think you can reduce that so that we have a conversation with these health facilities. Because remember, you might be the director of a health facility, and then one of your staff makes a decision to deny someone treatment. You know, maybe because they follow the protocols which are there, and they are not able to get a hold of you. So by the time they find you, you've already been charged these 3 million shillings. 3 million shillings is not pocket change. If what we are charging governors for not appearing is 500,000, yet accountability is a must for the resources, because those resources also include resources that takes care of these health institutions. Why then don't we reduce this from 3 million shillings to 500,000 or something like that? I know this bill is a balancing act between humanity and financial obligations, but I think with the submissions that we've made, both from that side and this side of the aisle, they will help the senior council enrich this bill so that it can become practical and one that you can be able to implement. You don't want a situation where people go to court. This association, Rural Urban Private Hospitals Association of Kenya, I guarantee you, Mr. Speaker, if the bill passes the way it is, they will move to court to protect themselves. Because there's no way you can set a business and then somebody tells you how to run that business. Otherwise, Mr. Speaker, I rest my case there, and yet to support when those amendments have been made.
So, Honorable Olekina, may you go on record? Are you supporting or opposing or supporting with amendment?
I think, Mr. Speaker, I was very clear that I can only support the bill with those enriched amendments.
Thank you, leader. I see from my list